but wherever you graduate from, whatever degree, DDS or DMD, you are a dentist. So that's 8 years. And if you want to start practicing as a general dentist, you can stop right there. However, if you want to specialize, you're looking at another 2 to 6 years of residency. Of course, this depends on what it is. If you're looking at like oral and maxillofacial surgery, that's like a 6-year residency. If you're looking at like pediatrics or just general residency, it's going to be like 2 years. Another factor that you want to take into consideration is the financial investment. Pursuing to become a dentist is a financial investment for sure. We're looking at about $300,000 to $750,000 for the 4 years. But also keep in mind that this number includes the personal costs, an estimated personal cost. So it includes those personal expenses, an estimated value, the tuition, any tools you might need. In addition to your tuition, there's the whole toolkit of all the dental instruments and any fake teeth that you need to get. So that price covers all of that, and it depends on the school and the location. Some states and some schools do have less tuition and less cost of living than others. And so when you reach that point, these are just some things you want to take into consideration. And another thing is the time investment. So this is different from the time investment of like the 8 to 14 years after high school. But this time investment is rather, and honestly, it's they say it's like a social sacrifice at times. I've like talked to many people that are like medical students, dental students, and a big thing they say is that like sometimes they miss birthdays of like their friends or their family members, bridal showers, baby showers, whatever it is. Sometimes they miss it because they have to study for like exams or labs or anything like that. So, and obviously with that, you're spending a lot of your hours a day, weekends, weekdays studying because of the rigor and dedication that this profession requires. So that is also something that a lot of people that are in dental school tell us pre-dental students, and we wanted to share that with you guys too.
Sorry, I was muted there. So other things to consider is that the physical experience of being a dentist is different from being a physician, such that you're going to be in a chair in an operatory, hovering over a patient for most of your day, if not like 8 hours of the usual work time. And so an effect of that is chronic neck and shoulder pain. It usually stems beginning when you first adjust in dental school. So it's just a learning curve or something that all students and dental professionals experience in their lifetime. So the only really real thing that you can do to combat that is to maintain proper posture in times when you're not working, or to fix your standard procedure when you're working to that, so that you don't have such bad pain. And that could be opting to stand up during the procedure, being ergonomically conscious with the way you operate around your operatory, I don't know, like situating yourself differently. There's a lot of ways to work around getting neck and shoulder pain, but it's one thing to consider if you are, you don't want to have to feel that kind of adjustment as you're going through this career. And the other difference between being, let's say, a medicinal doctor versus a dentist is that the physician is more so diagnostic work. Although dentists also do diagnostic work, it's very predictable diagnostic work. It's more so something that you are for sure that it's going to be a diagnosis of, whether it's a cavity, it's an infection, there's an abscess, it's a cracked tooth. It's very visual. It's not so much guess and check and very long term, because it's usually followed up with procedural work. So you'd say you have an x-ray and you look at it, you know what you need to do. It's probably a crown or you need a filling. Let's schedule that for next week and get them in and get them out. Like, it's very predictable. And if you like predictable work, then this is the career for you. You don't like any surprises unless there's like a really rare case of like a new dental disease that was never discovered, then that's a different story. But being a doctor is a bit more strenuous in that you have to really study the symptoms of the patient and know from them what they're experiencing, and to give a diagnosis from that. An additional thing to consider is the lifestyle. It is monotonous. You are going to be experiencing the same things every day, the same routines, basically, especially if you specialize in a certain field of dentistry. You have like a set certain amount of procedures that you perform for your patients, and you're also going to be seeing the same people usually routinely in your career. So they'll probably come in every 6 months, maybe every few months for some other dental work. But if you like having regularity in your schedule, then dentistry is something that you should consider, so that if you're not like someone who likes surprises or needs a very stimulating environment every day. And the last thing that you should consider is that dentistry mainly focuses on the mouth. Although you do have to learn about different pathologies related to the entire body, as well as just learning about the anatomy of the entire body, you're more so gonna have to focus on the mouth. So if your patient comes in one day and asks you randomly about like maybe why they're suddenly having, I don't know, arm pain or shin pain or like foot pain, then you can't really help them, and you don't really like have the experience to help them. I mean, unless you like took your time out to practice some more and further your knowledge in those fields. But so yeah, your field of knowledge is going to be mainly focused around the mouth, and you should be comfortable with exploring the mouth, whether it has any odor, any saliva, any other fluid, whatever you catch in the mouth, you should be very comfortable with, because you will inevitably experience those. And I have personal experience experiencing these stenches from the mouth if you're removing a crown or an old decayed filling and all of that. So it is an experience to be a dentist. But if you are up for that kind of lifestyle, then it's something that's really gratifying.
Okay, so this slide is a very important slide of this presentation. This is because we kind of broke down the common route to becoming a dentist and kind of broke down what each step of the way is going to look like. Before I get started on this, I do want to mention that there is no single path to becoming a dentist, and it's important to recognize that everybody kind of has their own personalized path. Some people, in fact, the average age for people who apply to dental school was 25 years old. So a lot of people come out of college not knowing what they want to do, and through meaningful experiences, they know they want to do dentistry. So their path may look different than what I'm about to present to you right now. So I guess my message with that is just to always have an open mind about what you want to pursue. So with that, the common kind of route to becoming a dentist starts if you know that you want to do this in high school, which I'm assuming you guys are interested in, considering you're here for this presentation. Take science and math courses. Specifically, the sciences, like if you're interested in taking biology, chemistry, physics, at the general level, and if you can, definitely go for the AP level. Actually, I took AP biology my senior year, and I ended up using those notes from AP biology in my bio class last quarter. So it all comes back around, and really the purpose behind why I say to take these science and math courses at a more harder level in high school is so you get exposed. The whole idea is the exposure to the rigor and to those topics, because they all come around, and that's the purpose of AP classes essentially. It comes around in college. So by exposing yourself to them in high school, it becomes a bit easier when you see it again in college. And you might take them, see that you're really not interested in those topics, and could lead you to finding what you really are interested in. As far as internships and shadowing, definitely get yourself involved as much as you can. ROP is a great resource for internships at such a young age. Like Annie did the ROP internship, she learned so much, and it opened a lot of doors for her, career-wise, even as a college student. So definitely, please do take advantage of that. Shadowing also, if you can like shadow your dentist, or if you have a family member in the field that you can go shadow. The idea is to just get your feet wet and get familiar at that point. And then on to college. The 4 years of college, obviously you have your academic preparation. Like we talked about earlier, there's no really major that you need. Anything you're interested in is fine, as long as you meet the prerequisite courses. So there is biology, chemistry, organic chemistry, and physics. That's pretty much required for all dental schools. Now, when you reach that point, certain dental schools do require more classes like math or like biochemistry, anatomy. That depends on the school and where you want to go. So maintaining a high GPA is important as for academic preparation. And there's also the DAT exam. So that's the dental admissions test, which is kind of like the SAT that you take in high school. This is just what you take in college for dental school. And it is required to apply to all dental schools in the US. And then throughout college, you're going to want to engage in activities like community service. So any kind of volunteering, um, or work experience. And it's also important to know that it doesn't have to be dental related. Volunteering is about giving back to the community. Healthcare is a field where you are serving people, you are helping people. And what better way to show that than showing that you're helping people even without being like a dentist? So engaging in the volunteering is very important. Pre-dental experience, that's like the shadowing and dental internships that we were talking about. And of course, if you have any like job in the dental field, that also counts as pre-dental experience. With that, dental schools just really want to see that you know what you're getting yourself into. Not like in a way as in you know what that they want to make sure that you know you love this field. And research. Research is optional. Some people do it, some people don't. But research is a very meaningful experience. So if there's anything that I'd say about research, it's that go after a topic and a lab that you are really interested in, that you're passionate about, because you put in a lot of energy and a lot of time into research. And it's really meaningful, especially if your work gets published. So definitely do research if you love it and if you love the topic. So with that, you go to dental school for 4 years, and we talked about DDS versus DMD. And then there's the optional residency and specializing, which is optional. Now, one thing I did want to mention is the option of a gap year. A lot of people, it's very common that they take gap years after college. They do this for many different reasons. Some people may be for a financial reason. They want to take a year off and save money and then go to dental school. Some people just do it to take 1 year off mentally, just to relax and get all their energy filled up again so they can hit the ground running for dental school. And that goes back to the idea that everybody's route to becoming a dentist is different. So if you feel that you need that gap year here and there, that is totally fine. But this is the general steps that you'll need to go through to reach that end goal.
Okay, next we just want to go over more careers in dentistry. I know we've talked a lot about like owning a private practice, being a general dentist, but really there's a lot of like different career opportunities within dentistry that you can go into. So while 80% of general practitioners are dentists, 20% choose to specialize such in things such as like orthodontics, endodontics, prosthodontics, etc. You can also go into teaching. So after you go through dental school, you can teach other dental students how to become a dentist. You can go into dental research, which is dental research are like labs, so you can like study teeth and stuff like that. You can also go into the dental industry, which is stuff doing with like dental machinery, medication, and etc. You can also work in public health agencies. I know like one of the draws for me was that you don't have to like follow others, so you don't have to work in a hospital. But like if you do like the hospital setting, you can also work in a hospital. You can work in the military. You can work in a dental correctional facility. You can work with like many other settings. I just kind of like touch upon some of those, such as like you can become a dental attorney. So if you'd want to go into law, you can um, go to dental school, go to law school, and then become a dental attorney and do cases related to that. You can go into dental forensics. You can also if you don't really like working with people too much or interacting with people, you can go into prosthodontics or become a dental lab technician because you don't have to interact with patients as much because you're just like kind of sitting in a lab like making crowns and other things like that.
Okay, so these are just some general tips that we wanted to end with for today's presentation. The one thing that I would like to say is to get your feet wet early. This was a piece of advice that an older friend told me, like my second year of high school. And at that point, I was a little confused, like, what does she mean? Like, why? But it is really good piece of advice. Getting your feet wet early exposes you to different fields, different passions. It lets you discover skills and strengths that maybe you never knew you had. And ultimately, this can open a lot of doors for you. And the benefit of getting your feet wet early is that if you don't like something, you'll know right away. And it's important to identify that so that you can take action early. Something big that we talked about in this presentation was the time investment and the dedication that goes into this field. And so by getting your feet wet early, you're able to kind of make that decision. And you don't have to make that decision right away, but it helps you to identify it rather early on.
And next, we just want to emphasize that dentistry is not an easier pathway. I know a lot of people may like think like, oh, if you don't want to go into medicine, then you go into dentistry or something like that. But really, it's not an easier pathway, as we said before. Like Eiler mentioned, it's a really big time commitment and just like a big commitment in general that you really have to like go for and strive for. And it's really not easier than medicine. And I'd say it's like pretty much the same amount of rigor.
Another tip for those who are interested in dentistry is I suggest picking up a relaxing hobby. You do not need to pick up hobbies that are always related to dentistry or benefit dentistry. A lot of students like myself risk burnout because of the high rigor that you face during high school and college, even before entering dental school. And once you enter dental school, the amount of work that you have to put in, whether it's learning about the different systems of the body, the memorizing the anatomy of the mouth and all of that, it's a lot of work. And a lot of students get tired and they feel like, and a lot of students now feel like, I don't know if you can relate to me, but a lot of students feel like they need to always seem like they're pursuing one single thing. Like they have all this interest geared toward this one career. They're super involved in all these different extracurriculars towards this one career, whether it's medicine or dentistry. But that's not always the case. It's good to have a hobby that you really genuinely enjoy doing in your off time to help separate your academic and work life from your personal relaxed life. So whether it's something like, I don't know, photography, doing art like llar, art just happens to benefit dentistry because it is a aesthetic field, but you can also do other things that you're into, like fashion, sightseeing and hiking, all of that. Like just have a good hobby that you can resort to when times become stressful and that you feel like you're losing that little spark that you had for dentistry. Because it does happen a lot with people, even older in the older population, older dentists. I've met a lot where they say like, yeah, I'm just like just getting by. I'm just trying to get through the day because it's just my career and I'm trying to provide for the family. But you don't really want to just exist to have a 9-to-5 job. You should trying to live as much as possible and enjoy life.
Yeah, so one of the good hobby that improves your manual dexterity, it can include like origami, drawing and painting, like I do, crochet or knitting, playing the piano. Like for example, playing the piano really works on the strength of your hands. And the more piano you play, the higher like the level of your skills go. The faster you're playing the piano, and um, it goes back to like hand-eye coordination. There's a lot of sports that focus on hand-eye coordination. So really the activities that can help you with your manual dexterity skills are endless. And sometimes you don't even realize that you're working on manual dexterity. But but you are. And it's a very important thing because if you have that manual dexterity skill, you are going to be like successful in your job as a dentist because those hand skills, they need to be strong. It's a very detail oriented profession. Um, when you're doing like root canals, when you're filling cavities, you're looking very closely at like tiny teeth. And so having those like having good manual dexterity skills will put you in a really good and successful place later on.
Next, we just want to inform you to reach out to dental professionals. It kind of goes along with the getting your feet wet early. You really want to reach out to these dental professionals in order to get their advice, kind of see what they do. So like shadow them, kind of like maybe interview them even just to see like what they do and if like what they do in their daily life intertwines with what you would want to do in your daily life when you're older. And also just getting advice from them is really helpful as well.
And our last piece of advice for you guys is it's okay to be afraid, but still try what you're afraid of. So what we mean by that is maybe you're hesitant to take a certain course or to contact certain professionals, whether it be dental professionals or other counselors to help take certain courses. You want to delve into research, but you're afraid of reaching out to faculty members that overrun the research. You want to try a different hobby, but you're kind of scared that you're maybe behind in the amount of experience that you have in the hobby. Just screw all of that. Just try what you want because it's your last couple years in high school and you really want to gauge where your interests and passions lie. And it's not worth being afraid for a short amount of time and having to risk the detriments of that fear growing later on into your career and your happiness in your life. So I re-advise you guys to just bite the bullet and take whatever classes that you're interested in or activities that you're too hesitant to try. Just put your foot in, sign up for it, and go with the flow. Like it might take you to a new other pathway that you never knew that you loved, but you'll really be thankful later on that you did take that chance. And so with that, we thank you for listening to us present today on the path of dentistry. If you guys want to contact us for any personal questions or any personal concerns that you don't want to share in chat right now, then you can always email us at our UCI emails right here that we mentioned. Otherwise, I'll let Nicole take back the reins.
Thanks, guys. If you have any questions that you guys want to ask right now in the chat, you can do that, or you guys can unmute yourself and ask a question real quick if you have something. If you guys don't have any questions, like they mentioned, you guys can always reach out via email. But do any of you guys have questions right now about anything they talked about, or what's it like to be a dental student, all that fun stuff? I'll ask one question and then maybe it'll spark something from the rest of them. So far through your, high school and undergrad experience, what's been like your coolest or kind of craziest experience you've had when you've done like an internship or activity kind of relating to that, when you've actually been in a dental office or something? What was your coolest experience so far?
Ooh, I remember one day when I was in my internship, I walked in and like 20 minutes after I just started getting adjusted, I put down my little sign-in sheet. I greeted everyone in the office. I got pushed into a room to take a bunch of impressions for this one patient because he needed a couple prosthetics done. I think it was like a partial on the bottom, maybe a couple crowns as well. And so it was just an isolated room with two professionals that I never met before. I think they were contacted from an outside lab that create these prosthetics for this man, but they just are associates to the dentist that I was externing under. And so I knew no one, but I had to pretend that I did. And so I was just like, hello, like, welcome to I am your dental assistant for today. I'm going to assist them with these impressions. So I just set up the room for them. I got him adjusted into the chair. I mixed up the impression material and then I took the impressions for him. Obviously at that point I still wasn't too skilled yet, and I was also nervous because I never met this patient before, so we had to take a couple intern, but the two professionals were really kind and patient. So after a couple of them, they said that these were really good and they would be usable later when they were creating the prosthetics for him. So I was really happy, and then gave me a lot of affirmation that I have the skills to be here.
Cool.
Personally for me, due to COVID, I wasn't able to go in for dental assisting just yet. But I did shadow when I was in high school. And one specific time, I remember there was a little girl, I think she was like 8 or 9 years old there, and she was very, very scared. And she thought she was just coming in for a cleaning, but she had an extraction that she had to do. And I remember at one point, I was left alone in that little room with her, and she was really scared. And at that point, I didn't know what to do. I think it was like my second or third time shadowing. So, and not many kids had came in. So I was like inexperienced, hadn't seen how they deal with kids. But she was like really scared. And so in that moment, before the doctor came and was gonna like numb her, which would make her more scared, I was in there trying to like calm her down and talk to her, and like I showed her like her x-rays on the computer. And then after a few minutes, she was like more calm, she was smiling, she was more relaxed. And that specific experience, and more with kids after that, made me like dealing with kids more and made me think about wanting to go into pediatrics. But that was my coolest experience thus far, knowing I haven't had much in a dental office.
Yeah, same with llar. I haven't had like that much experience since um I haven't been able to like go into the dental office and like actually be there because of COVID. And but I guess like the coolest thing I've seen was just when my dentist showed me how he made like a retainer. I know it sounds like really like ordinary, like not that exciting or anything like that, but I don't know, that was just really cool to me. If you have the chance, just look up like how people make retainers, but I thought that was really cool.
Cool. Do any of you guys have questions for those three? If you don't, while we're waiting to close up, if you guys can scan the little QR code that's on your screen, if you have your phone up, that's a little student evaluation. It will just have you check in again, and it'll ask you a few questions on how you like the presentation, so we can just get some basic info. But also remember, if you checked in and then you fill this out, they do have, we have a little raffle for anybody who finishes both. So just keep that in mind, but we like to have everyone fill that out. So if there's no other questions, you guys can hop on off, but anybody last minute questions before we head out? You know, everyone's sleepy on a Monday. All right, well, make sure you guys fill out the student evaluation before you do leave, okay? All right, well, thanks for joining us, everyone, and have a good day.
Thank you for having us.
Thanks, guys.
Your time here.
you.